from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
All right, we're back with our sponsor, Baptist Health, this morning, and this month's Keep On Amazing, Brady Lacy and patient Dr. Dale Fuller here to talk more about the cardiac rehab program. Gentlemen, good morning. Thank you so much for joining us and telling your story. Dr. Fuller, I think this is important to share, and you being a doctor, I think is also pretty interesting and unique about this situation. Why don't you tell everybody what happened, how you got involved in this program?
Okay. Last October 24th, that morning I got out of bed just feeling great like I always did, and about 30 seconds later I had acute onset of severe chest pain.
Really?
Yes. And I've got a medical background, and I was thinking, surely that's not a heart attack. I have no family history, and I have no personal history of it, but it was intense.
Yeah.
And I was trying to imagine it might be other things like a spasm of the esophagus or something like that, but then when it started going down my left arm, that was good enough for me.
Yeah,
so
sure.
I told my wife, we made a quick trip to Baptist Hospital, and the ER there, they did EKG and made a quick diagnosis of acute heart attack.
Wow.
And then Dr. Scott Davis came in and made a quick trip to the cath lab to open up a 99% blockage of my main coronary artery.
Wow, so the main
one they call the Widowmaker.
Really? Okay, so scary moment. And you being a retired doctor, you knew the signs and symptoms well enough, and that's why when he was talking about, okay, what could this be? Symptoms and signs are so important, and the immediacy of getting to the hospital also important as well.
There's a 90-minute window, if you can get there and get the artery opened, that there may not be enough damage to alter your lifestyle in the future. But even as a retired physician, I was trying to imagine it was something else. But if you're having chest pain of that kind of intensity, you need to make a quick trip.
And so you have the heart attack, you get the blockage cleared. Dr. Scott Davis and the team over there, the cardiologists, do their job.
Yeah. Yes.
So Brady, what's next? So everybody thinks, if I make through this, and he was able to, what's next after that?
Yeah, it's like cardiac rehab. It's basically therapy for the heart.
Okay.
So we start seeing patients about 2 to 4 weeks out from the cardiac event. So kind of in the program, we have them on a heart monitor, just kind of watching their vital signs, getting their blood pressure, just making sure everything is within parameters. And then just kind of slowly start to increase that exercise intensity as they keep coming back too. So like each patient in cardiac rehab will have their own exercise program based on their exercise mobilities, because everybody's not going to be the same as the next person. So we kind of modify it for the patient as well. So plus we stay in contact with their physician every 30 days so their doctor knows what they're doing and how well they're progressing too.
Communication is so important in this process. Yeah. Dr. Fuller, so what was it like for you going through this? How do you feel now? What's been the recovery process like?
Well, when you leave the hospital, you wonder, what's my life going to be now that I've had a heart attack? You worry that you're going to be limited. And so they sent me to cardiac rehab about 3 weeks after I had the heart attack. And they hook you up to a monitor. It's a wireless monitor. And Brady, actually, as a personal trainer, and they evaluate pretty quickly what your ability is going to be.
Okay.
And I got there the first day, and they got me on the treadmill and the bicycle, and they were pushing me pretty hard. But, Brady knew that the stents were there and the cardiac flow was normal. But I remember thinking, I said, you realize that I had a heart attack 3 weeks ago, don't you?
You're like, don't give me another one, right? Yes.
But it's 36 visits over about 3 months. And it's an hour's exercise, and on the treadmill, on the bicycle, and weights. And they push pretty hard, and they won't let you go backwards each day. You have to progress.
Okay, so progress has to be made. Now, who's a candidate, Brady, for something like this? Do you have to have a heart attack specifically, or?
No, it's like heart attacks, bypass surgery, stents, like valve repairs or replacements, or heart failure and heart transplant as well.
So multiple candidates for this.
Anything pretty much with the heart procedure qualifies for cardiac rehab.
And Dr. Fuller, you're feeling now, do you feel better than ever? Or?
I feel better than I've ever felt, and the tests now show that my heart is pumping in the normal range.
Nice.
And so it's not going to be a limiting factor for me, and I've continued the exercise and healthy eating for sure, because this really got my attention.
I'm sure, and it's a wake-up call for a lot of folks, and certainly an opportunity for you to get it better, make it stronger, and keep on amazing, and that's exactly what you're doing, Dr. Fuller. Thank you so much for sharing that story today. And Brady, thanks for coming in this morning and talking about the program and telling us who's eligible for this. If you want to find out more information, it's simple. All you got to do is call the Baptist Health Line. It is on your screen right now, or go to baptist-health.com. We'll see you guys next time.